Welcome, everyone, and welcome to another episode of Quest by Community Our Health Matters in 2025. And today we have the absolute pleasure of welcoming Teddy Cook. Many of us are familiar with that name. Many of you would have heard the name synonymous with trans health and well-being for the past 25 years. We're going to deep dive with Teddy into his new ventures in his new appointed role with Equality Australia, and also talk about some key aspects when it comes to trans health and equity that just not all impact just the trans and gender diverse community, but every single community member across Australia. Welcome, Teddy Cook.
Oh, it's so good to see you, Ricky. Thank you so much for having me.
So let's begin with a reflection of your personal journey. Can you share some personal journey and experiences that led you to become an advocate and land up at TransEquality Australia?
Um, you know what? My story to becoming an advocate is a real accidental one, which I think we hear about a lot. People find themselves in a space where they might be the only trans person all of a sudden and kind of really start to see that there may be some changes that can be made to improve, the experience at work, but also um, the experiences for trans people more broadly. And I certainly found that when I started at ACON, which was in 2012. And before that, I'd been working in a range of sort of community spaces and had been involved in a lot of NGOs doing a range of things from kind of, I was an administration manager to a co-op manager and held a range of different sort of leadership roles in the kind of mainstream NGO community sector. But I always felt a calling to be working more in queer and trans community spaces, and so I volunteered a lot. While I was working elsewhere, volunteered for ACON, volunteered for various things to kind of connect me into community. Um, I grew up in Western Sydney. I'm a Penrith boy. I was the first trans person that I met, so didn't have lots of information to go with when I was affirming my gender. I came out over 20 years ago, 25 years ago. It was, it feels like a world ago now, a lifetime ago. Um, and what I found was very limited information, very limited understanding. And certainly when I started to work at ACON, um, and ACON, this was 12 years ago, had quite recently in its journey kind of added T to the acronym of its work as a LGBTQ organisation with a particularly robust and grounding history in HIV. I found myself being the only trans person at work, and I thought, oh, okay, well, this isn't gonna, this probably isn't gonna fly if I um, kind of don't insert myself into some of the conversations and processes that were happening. So I think over the course of many, many years of just kind of consistently and continually showing up for trans people through my work at ACON, um, I was able to contribute at a policy level, both internally and externally at ACON, to really kind of push the dial. I like to kind of say that I helped capitalise the T in LGBT at ACON, and so it's something that I'm really, really proud of, and something that continues really, really strongly. Which is wonderful to see after I left in August last year. Um, but yeah, that's my personal kind of journey. Is sort of, I'm a Westie working class kid with a twin,
Mm.
and My twin's non-binary and also working in this space, doing amazing stuff with Rainbow Giving Australia. Jones is my twin's name. Um, and we were kind of runabout kids trying to figure out who we were. And I found myself in Queer Newtown, you know, many years ago now, and from there started working quite a lot in regional New South Wales too. Um, and in my work, I worked for about 5 years for ACON doing regional outreach in some very remote rural areas, including, the far west of New South Wales and very small little towns like Wilcannia, Menindee, all the way to Wagga and Wollongong. And I found in that work, which was health promotion work, really trying to extend the reach of ACON's messages and services into the bush. Our community is everywhere. And I wasn't shocked, but I was just in awe, really, that, in every single place I visited, and I would be visiting country towns every 2 weeks or so. I found trans people everywhere in every place that I ever visited, even with a population of 1,000 people. There'd be at least one trans person, and a lot of the times that trans person was a real community leader. Um, for instance, there's Holly in Wagga who runs Wagga Mardi Gras, trans woman. There's Rena in Wilcannia, sister girl in a population of 1,000 people who is, just constantly doing work to elevate, the communities that she's part of. So um, I really just found that if when I met so many trans people, so many queer people of all ages, and their families, that it just was constantly reassuring, I think, to me that our communities not only are everywhere, but have always been here. And um, I found that, for the marriage equality vote, it was a really beautiful thing to experience that there was no regional town in New South Wales, or, no regional electorate in New South Wales that voted no. Um, and that was just, I think, just a really beautiful thing to see. That, the idea that we have that country towns don't welcome our communities is wrong. It's not true. Um, Regional country towns want to keep the people, don't want to lose their populations, don't want people to be fleeing from, you know, their towns. So, and certainly I found that in my work with Mob as well. The amount of Aboriginal mums that I met who had, a gay son or a trans daughter, or, certainly always a gay cousin, um, where it was just so beyond them to understand why our communities would face such exclusion. So that, I really modeled my work, I think, in kind of First Nations approaches that really connected in with the community at that ground level. So I was able to take all of those stories and all of those experiences into Parliament. And I've always felt like I'm carrying the voices of so many people um, when I'm representing the community in scary things like, law reform, or running up to different inquiries where I've got, pretty scary politicians coming for me. It's really interesting, but I'm able to hold that, which has been surprising actually for me. I'm really not in fit. I don't love conflict. I don't like particularly being in spaces that are hostile, but it's just what I've gravitated to, the kind of things that I'm really interested in around trans health or trans equity or trans liberation. Um, Are really pointy things like suicide and domestic violence and sexual violence and police violence, and the kinds of conditions that we have in place that allow trans people to thrive is, means getting into the, pulling the sleeves up and talking about, Uh, not really talking about pronouns or bathrooms so much. We're talking about people being able to walk through the streets safely and access the care that they need where they live, um, without facing endless referrals or being able to walk down the street and not be yelled at. I mean, that feels like a pretty minor thing to need, um, to live free and equal in society. So the kind of advocacy asks are always pretty basic. Um, I think we have this idea that the trans movement or trans rights is really complicated, that we're trying to do things that really kind of shake the foundations of society. While I think that the foundations of society could really be shaken, I'm just not sure that 1% of the population is doing that. Certainly not our 1%. I'd be concerned about the other 1% that is certainly driving a lot of the horrors that we're seeing in our world today. And that 1% certainly isn't the trans 1%.
So, what do you see are the biggest challenges facing our transgender and gender diverse community in Australia today? And how does
Mm.
trans equality address these challenges?
I think, what we're experiencing is a kind of regression of really good, strong trans health policy that recognizes that trans health is actually a social determinant of health. So when there's barriers to accessing, whether it's gender affirming care or to be able to go to the GP and be understood, that is a really significant challenge that our community can face. We know from a range of different research studies that, you know, certainly for trans kids, a minority of trans kids access puberty blockers. It's about 5% of trans kids are able to access puberty blockers, even though many report that accessing the care that they need has been really challenging. You can compare that to a media discussion that sort of suggests that the trans experience is wholly medical, or that trans kids are being pushed down some sort of conveyor belt. But actually, the challenges that we experience, the barriers that we face to get basic health care, is really significant and really makes a big, big impact in our communities. So the biggest challenges that we're facing, I think, are attacks, ongoing, relentless attacks from a very small population of people who are deeply obsessed, problematically obsessed with us. When we're not thinking about them at all,
Mm.
we're thinking about staying amazing and being connected with our friends and doing our thing. And they're completely obsessed with the idea that we exist and want to live in life, or participate in our communities. So there's this sort of constant barrier of trying to get things moving, because this very small group of people seem to be quite loud and also seem to be interested in kind of blocking a lot of work by taking up the resources of different bodies, by um, engaging in freedom of information requests that take ages for people to respond to and get all the information that's needed, and constantly responding to, different kinds of media or different kind of lobbying to conservative politicians. That means that as advocates, we need to be reacting when we'd all much prefer to be being proactive and, responsive to our community's needs, instead of fighting back with this, by the way, we exist, or by the way, puberty blockers are safe and fully reversible. Um, but also, why do we even have these discussions about whether medications are reversible or not, when, you know, it's not something that happens in any other area of healthcare? It's
Mm.
like antidepressants are reversible too, but is that something that is talked about a lot? No. Um, but, the key things around trans liberation, the policy issues that seem to be, really impacting trans lives, actually really, really simple. accessing gender affirming care where we need it, when we need it, where we live for free, all things go to plan. And gender affirming healthcare can range from going to the doctor to talk about how you're doing, seeing a counsellor, getting a haircut, changing or updating your name, using different pronouns, to using puberty blockers if you're about to start puberty, to hormones, to surgery. But the expansiveness of gender affirming care is often narrowed down into some sort of surgical thing. But when in the trans experience is not at all medical. We're not unhealthy people. Actually, we're healthy people accessing a healthcare system that isn't prepared for us, and that can sometimes be a barrier. But being able to move through the world free from discrimination, free from violence, being recognized for who we are, being able to legally affirm our gender if we want to for our documentation, and being connected to the community, being having a sense of belonging, is a really critical thing for so many of us. So healthcare when we need it, living free from discrimination, and being connected to community are the three primary things that lead to, better trans lives. So it's not like we're talking about, massive structural changes. We're just talking about respect and having healthcare available. It's it's not that I don't think it's that controversial. Um, but yeah, there is a small group of people that seem to be very obsessed with, you know, whether we're walking down the street or not. There's YouTube channels about me, there's videos about me, there's articles. I've even seen a presentation about me. I'm like, wow, you're so obsessed about me. And I'm just hanging out with my little Pomeranian Gucci and catching up on Survivor and being amazing. I mean,
I think, Teddy, that leads quite beautifully to the other area that you talk quite a lot about the last couple of years, and that is understanding intersectionality when it comes to access for affordable healthcare and education and other spaces, including housing. How does trans equity approach the intersectionality of gender identity with other social issues such as race, disability, age now, and socio-economic status? And why do we need to look at those aspects alongside when we talk about transgender and gender diverse identity?
really, 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 really important. So important, so essential. Um, and I'll say as well, trans equality is a project of Equality Australia. So, Equality Australia was born through and out of the marriage equality movement, and is an organisation that is very small but has a real grounding in such strong policy and engagement expertise. Their understanding of law reform and the law generally is just so next level and so wonderful. And I've been able to start working with Equality Australia as both the chair of Trans Equality, but also as a senior advisor to be available to them in relation to their work with trans rights and help lead that work with them. And this work can't happen without recognizing that not all trans people have the same experiences in life. If we thought that the trans experience was an entirely um, that was the same for everybody, then, I think that we'd be really missing out on the rich complexity of what it means to be trans and also the history of what it means to be trans. So, for instance, we know that this place that we call Australia is home to the longest living continuous cultures on the planet. And that means that this is also home to the longest living trans cultures on the planet. If we have a population, a cultural population that has been existing for 65,000 years, that has language for trans people and ceremony, names, for trans people, a history along, uh, the song lines is really, really, it's really reassuring, I think, to remind us that we've always been here, but the kinds of critical things that we need to make sure are included in our work that go alongside and are, you know, contingent on us reaching trans liberation are those other social determinants of health. So, for instance, racism, ableism, class is, are really key tenements to make sure that we understand and are elevating the needs of to make sure that we're not leaving anyone behind. I always say and always think that if the focus of the work means that sister girls can access everything they need where they are, then everybody else is going to be okay too. If we remember that sister girls are some of the most resilient, but also one of the most marginalised population groups on the planet, being an Aboriginal trans woman, if we focus on her, if we focus on you, then everybody else is going to be fine too. And that's always been the focus of my work. I don't, when I'm talking about my stuff, I don't really talk about me because I'm a bit boring. Um, I tend to try and elevate the experiences and voices and needs of other people because, um, if we're not talking about religion, if we're not talking about multicultural communities and how they look after each other, but also how they're being so deeply oppressed by white supremacy, that if we're not talking about class and disability, employment, um, you know, drug addiction, if we're not talking about the kinds of experiences of violence that many in our community face on a daily basis, if we're not talking about sexual violence, domestic violence, if we're not talking about the kinds of things that lead to the situational distress that lead us to suicide, then we're leaving way too many behind. And I think that that really starts with looking away from the city and looking towards other regions within the Pacific as well. Um, I think is really, really critical. For instance, I'm really interested in exploring um, how mob might feel and be affirmed by recognition paperwork that reflects their name and gender. Um, I've spoken to a lot of mob along the years who haven't been able to update their recognition paperwork, and that's something that is, impacting their lives. So it's not always about birth certificates. It's not always about passports. It's about the kinds of things that are impacting the person on in their lives. And TransEquality wants to hear all about that and be able to represent those stories and voices in the advocacy that we do, which is, campaigns, policy work and advocacy, political engagement, working with such interesting politicians. At a state level and a national level, to really push the dial and to help them understand trans people. The thing is that trans people are so deeply misunderstood. We're understood through this lens of sex change,
Mm.
that we're not who we are until we've had surgery. And it's like, no, we are who we are when we tell you. And that's the thing to remember, that trusting trans people when we tell you who we are is kind of the main thing. It's the main thing. If we're affirmed, if we're respected, if we're said, yep, I believe you, okay, what's your name or what do you need, then that's the kind of stuff that reduces or ameliorates gender dysphoria. It's gender distress occurs when we're misgendered and when we're not allowed to be who we are, on our own, when we realize we're trans and we can live that life of being affirmed ourselves in the ways that work best for us. We're amazing. We're thrilled. We're happy. But we move into the world and people are like, oh no, that's not allowed. What does that produce? Gender dysphoria. So the easiest way to, ease the distress of not being affirmed is to be affirmed.
Now, we have a lot of people in the community like yourselves who have worked tirelessly over the years to bring about our voices to the table. But now I want to ask you, is it important now? Are we at the stage where we need to kind of go a little bit further and really find within our own community leaders to take on that politics overall and actually stand up to become a leader of a party, or dare I say, the next prime minister, to affirm themselves as being part of our community or connected either by having a partner who is gender and transgender identifying? Are we ready? Or should I ask the question, is that the next step as well that we need to be considering to make change?
It's a very good question. I feel a bit mixed about it, to be honest. One part of me is like, yes, absolutely. And I see, there's already people who are in state politics in particular who are trans, or local councils. I'm seeing an increasing number of local councillors who are trans, which is really amazing to see. But I also see those people being really, really attacked, um, and facing the kinds of barriers that are not only painful but are also really demotivating. So I think that, first of all, I would say the more trans people involved in policy and politics, the better. And I say that with a recognition that when I say more, I really mean it, so that it's not just one person that is holding everything. Um, so in New South Wales, for instance, I look at Alex Greenwich, who's the independent member for Sydney, who's one of the only out gay men in New South Wales Parliament, who has done an incredible job of understanding trans people, understanding trans needs, and really elevating those. And as a result, I've also seen him be savagely attacked in multiple ways, in multiple spaces, by multiple people in ways that are just disgusting. Um, so while I think that the more trans people involved, the better, it really does need to be more, not one. And it needs to be more people that can be supported and can also get along with their job. So, like, I look to Sarah McBride, for instance, in the US Senate. She's a senator, I think so. She's a trans woman, Democrat from Delaware. Her job is to represent Delawareans. That's her job. Um, but I also see that she's being tasked with holding the trans community against the Trump administration on her own. And I'm just not sure that's sustainable. Um, and it's also not her job. So I think that we talk about when you started a new job and you become the trans person at work, and everything that's trans gets asked to you. I've seen that playing out in politics too, where there's like one representative is trans, and then they have to hold the entire community on their shoulders. Which I don't know that that's sustainable or appropriate. Um, but also, I'm seeing things like Joe Ball become the commissioner, LGBTIQ commissioner in Victoria, open trans man. Having a leadership role within government is so important to see. Um, so I don't know, I think I'm mixed in my views. Yes to more trans people. Yes to those trans people being really supported and protected and the community getting behind them and sustainably, um, using their influence in a way that will benefit our communities if that's what they want to do. Um, being trans isn't a qualification. You do need to have an understanding of the political system, which is actually really beautiful and interesting to learn. But the key thing is that you need to get used to working with people who have a very skewed, weird understanding of the trans experience and of trans communities more broadly. And really ask questions that you need to be ready for to hold and laugh about later, really. But um, it takes a lot of years to kind of grow that thick skin. And even for me, like last year, I was really like pretty savagely attacked in the media, in the
Mm,
mainstream media, after I was appointed to a guidelines development group to develop with the WHO some global trans health guidelines, which is really exciting. But as a result, I was like targeted in all of these newspaper articles, and then I fell across accidentally a protest. There was a protest when I was crossing the road, and I saw a protest, and I was like, "Yes, to the people, love a protest." And then as I got closer, this fellow came over to me with a flyer, and he said to me, "Excuse me, ma'am, would you like a flyer?" And I was like, "Ma'am, did you just call me ma'am? Let me just check." And he looked me in the eyes. Mind you, this is a group of 10 people, so there's not that many. But he looked me in the eyes and he said, "Teddy Cook, we know who you are. You're a woman." And then they all just started yelling and screaming at me that I was a woman in Martin Place in the middle of the city of Sydney, across the road from Parliament House. And I just thought, wow, you really think being a woman is offensive and that that's going to offend me, which it didn't. But I tell you, being yelled at and misgendered in public by a lot of people really left a mark on me actually, and kind of really it was a terrible experience that I wouldn't recommend on anyone, to be honest. But I think it all happened at the same sort of time, like being attacked in the media, then being attacked in person. It was like, wow, this is people know who I am, and that made me feel a bit uncomfortable. Even though I'm very public, it's like
mm.
I'm really public. People know who I am, but wow, you really think you know who I am, and you think that if someone calls me a woman, I just think as a defensive thing, I just think they're showing their misogyny. It's not, like women are great. I'm just not one. But that kind of attack. I know that I'm on as many, in a database that's wanting to get all of our personal information so that we can be doxxed and like knowing our dead names or former names and all of this sort of stuff. And I just think, wow, you're so obsessed. It's embarrassing, I think, when people are that obsessed with trans people, particularly trans advocates. We're fully just, trying to make our lives better for us and our mate.
What is sad, I guess, when we try and do the work we do and the work you do is that you're not just making it more accessible for our trans and gender diverse community, but for everyone. Anyone who's marginalized or has access issues, whether it's due to poverty, lack of resources. Yet there is this almost power hatred about, you know, reinforcing a notion of binary thrusted back and looking at destroying anybody that sort of challenges, the status quo. I want to ask you an important question that I'd like to ask a lot of the people who appear on here, and that is a call to action. One thing is we could talk about issues and talk about ways moving forward, but I want to now for you to reach out to our audience. What can they do? What message would you like to share with the audience on how they can support our trans and gender uh, community, what they can do within their own communities, whether you're yourself part of the LGBTIQ or you want to be an ally? What can we do today?
Yes, great question. Great question. One of the first things that we can do is really educate ourselves to understand the trans experience. And I definitely recommend a resource like Trans Hub, that you can find out lots and lots and lots of really good information written by trans people. Now, I will say I'm one of those trans people that wrote that. But uh, it really does provide fantastic information and a fantastic introduction to who the heck trans people are. So that's a good place to start. Um, Particularly if you think that trans people, you've got ideas like we're born in the wrong body and that we're full of misery and we hate ourselves and you know all of that sort of stuff, and that what we're after in our lives is the surgery. Now, none of that's true. So, a good place to start is information written by trans people that really depathologizes an introduction to the trans experience that's got nothing at all to do with medicine and everything to do with freedom and self determination. One of the best things that you can do today as a cis person is meet a trans person, be friends with a trans person, but just not in a, don't be weird about it. That's the only extra little bit of advice I'd say. Don't be weird about it. But if you have the opportunity to meet a trans person and be friends with a trans person, you're very, very lucky. And treat that trans person with the love and respect that they absolutely deserve. But what we know is that as soon as a cis person has a trans friend, they become positive towards trans rights. And so I would say to the trans people listening to this, make a cis friend today. You can totally make it as weird as you want. But one thing that I have definitely found is that when a person in power or a person down the street have a good, proper understanding of trans people and the trans experience, that they're much more likely to support our needs, which are, like I said, being able to live, walk down the street, access the care we need, be connected to community. And so that kind of understanding is really important. Now, once you understand the trans experience, you've got some trans friends, but even before that, you need to chat to your MP. I'd recommend that you write to your state and federal MP, and particularly, we've got a federal election that's going to be called any moment. The last federal election was really trans. It was really focused on trans. Political candidates were being asked by quite a hostile media questions like, what is a woman? How do you define a woman? When actually people are much more interested in cost of living, for instance, housing, education, health, being able to pay their bills. And so being really unequivocally clear that this election shouldn't be trans because we don't want to punch down to a vulnerable population. It's 1%, 0.9% of the population. Put that into numbers, it's about 180,000 trans adults in Australia. It's not really that not many of us. And certainly we don't deserve to be the target of a federal election when people fully cannot pay their bills at the moment. So, write to your candidates, write to your political party, write to the MPs and say, do not make trans people the wedge issue that you think it is, because it's not. We're not a wedge issue. Polling that certainly Equality Australia has done consistently tells us, consistently reminds us that the Australian public, and that includes our communities, of course, but there's only 4.5% of our population in Australia, relatively. That 95% of the general public that aren't part of our community want our community to be safe, don't want our community to be, broadcast like a circus, want us to be able to access the care, the jobs, the support that we need without being abused and assaulted, and that the vast majority of people want us to access the healthcare we need like everybody else can. So it's important to remember that it's a very small population of people that are obsessed with us in a bad way, that the vast majority of people either don't care or are very, very happy for us to have a good life. And that's important to remember. So assume that when you're kind of thinking about trans advocacy or trans equity, trans equality, assume and know that the vast majority of people either really like trans people, and that's fine. Just get out of our way. That's the thing. What we want is to be able to grow old with our mates and just leave us alone to do that if that's at all possible. And that's the message of support I would give, or the message that I would leave you with. Get a trans friend today that isn't in a creepy way. Learn more about trans people, and then we need you as a cis person to be on our side, and that means engaging politically if you want to, but also talking to your friends and talking to your parents and workmates to say, if someone's talking about trans people in a way that isn't okay, just interrupt it and say, you know what? My experience of trans people really isn't like that. My experience of trans people is that they're just regular people wanting to get on with their lives, really not wanting to, you know, break apart the fabric of society, but, just really kind of getting right sized about it. There's not that many of us. We're just trying to get on with our lives like everybody else. Take a chill pill. That's okay. And recognizing that for our young people, and this is something that is, really, really, really misunderstood, that the medical treatment of trans kids who are prepubertal, so from 0 up to like 12 or 13, 14, the medical treatment is literally zero, none, no medical treatment. It's about respecting them. It's about saying, yep, call you by your pronoun, call you by your name, call you by your, get a haircut, great job. A very dear friend of mine, when she was growing up, she's a cis woman. She would not do anything until her parents called her John Travolta, and that was fine. Totally a John Travolta until she wasn't, and that was fine too. But it's when kids are getting to puberty that some of them might want to access puberty blockers, which are safe, reversible. Reversible is a tricky word to say because all they're doing is stopping puberty. It's stopping something from happening. If you stop taking puberty blockers, then your puberty starts, and whether that's through gender affirming hormones or your natal endogenous system starting to kick off its own hormones, then just understand that the medical treatment of young people is certainly in Australia and most other countries as well, uh, delivered by a multidisciplinary team of experts that centre the child and their families and are responsive to that kid's need. That's all you need to worry about. But certainly, there's no conveyor belt to hormones or surgery. No young person in Australia is getting surgery. There are no genital surgeries happening on children, and that is really, really important to recognise. And if you think that it is true, then you're being influenced by conspiracy theorists.
It's been an absolute honour having you come into our homes, spend a lovely time with us so we got to know more about you and the wonderful work that's done at Equality Australia and all the messages of love and hope that you've given us today for us to think about and our call to action that we can all do. Thank you so much for coming into our lives, Teddy, for all the wonderful work that you do. Um, I really deeply value the spaces that you've created for other people to follow in your footsteps, and that you are, one of the most highly regarded community people that I know and deeply respect and have the honor to work with before. Thank you for your time today, Teddy Cook.
Thank you, Ricky. I feel exactly the same way about you. You are an absolute legend, an icon, and a hero. And it is a true honour to share space with you today. So thank you for having me on.
Thank you to our wonderful audience, who we can't be without you, for watching Quest by Community Our Health Matters, because your health matters.